undiagnosed dementia is extremely common. From a variety of different studies, we know that about half of older adults with dementia are undiagnosed or unaware of a diagnosis, and some studies also put the prevalence even higher, around 60%. So it's common, and perhaps even more common than diagnosed dementia. So the best studies are studies that do essentially a research diagnosis of dementia. So they will perform cognitive testing as well as obtain clinical information from the research participant and ideally a study partner, where then experts can use that information to say, does this individual have dementia or not? And then look at the patient's medical records to see, has it been diagnosed in the medical record? And so the individuals who are undiagnosed in the research study meet criteria for dementia, but you don't find a diagnosis in the medical record, nor does the patient or a family member report a diagnosis.
Okay, and why is this concerning if there's undiagnosed cases out there?
This is concerning because if they have dementia, though it's undiagnosed, that means they have cognitive impairment, such as memory problems, and they have functional impairment or difficulties in everyday activities as a result of their cognitive challenges. And that can mean that they might be having difficulties with driving, with managing their finances. They might be interacting with family members differently, yet the patient or the family is unaware of or not realizing why these changes are taking place. So we see both, but I will say in the vast majority of cases, it is a family member who's bringing in the patient, often an older adult with dementia. But we do have cases where both the patient and family are concerned, and a minority of cases, but certainly we do see cases where a patient brings themselves in, often because they have a family history of dementia and they're concerned about changes that they're noticing within themselves. So many studies have actually shown that most older adults actually say they would want to know about a diagnosis of dementia if it's made, though at the same time there are patients who might screen positive for dementia who then refuse further workup. But most older patients do say they would want to know. What was the first part of that question again?
And I mean, given the limited treatment options, is it medically helpful to know?
Yeah, I think knowing varies from patient to patient, but I think big picture, some of the benefits to knowing is, one, to have the patient and family enough time to plan for the future, whether those future changes might be needed in 5 to 10 years. Patients and families can prepare for what they want that care and support to look like. Earlier diagnosis can also help prevent potentially adverse events. So you might be able to, prevent a serious car accident if a patient stops driving in a timely manner. You might be able to prevent financial errors that a patient might make if they're living undiagnosed. And then ultimately, I think it's also to just allow patients and families to understand the changes that are taking place in the patient and really to be able to support them through what we know is a difficult condition.